Welcome back to another Elevation Association Experience podcast. Joining me today, I'm your host, Dr. Dan Nelson, with my co-host, Dr. Jared Hill, and we've got I'm going to make the data wizard stick somehow, Ryan. I'm going to have people call you the wizard. That'd be
the wizard.
I think that would be awesome if people start walking up to you and start calling you, "Aren't you the wizard?" That would be. And then we can turn it into like it's a cosplay thing that you do. It's not actually anything to do with data. We can make it weird. So Ryan Passey's with us today. And that's for a specific reason. We love to bring Ryan loves to podcast, first of all. He's always bugging us. He's always like, "Guys, can I be on the podcast today?" And we're like, "Yeah, I guess you can be on the podcast today. Fine." No. So we're letting him on just because he won't leave us alone. And also because he knows more about this topic than we do. So, so what we're going to talk about, we've got some interesting things to go over today. I think this is going to be meaningful for a lot of you, and I'm just going to drop some kind of a gut punch for us. And here's a number that should make everybody mad. So for every $1,000 of dentistry you produce, the average PPO practice is collecting only about $550 to $580 of that. So that sucks. Like the rest, it's gone before you even ever see it. And so that is based on, I'm going to be pulling a lot of data. I've got some statistics up on my screen today that we're going to be pulling from. But that's from Dental Intel. So Dental Intel is reporting that the average PPO adjustment runs between 42 and 45% across general practices. That's freaking crazy. Guys, that's nuts. And then a typical dentist writes off 3 to 6 million in PPO adjustments over the 35-year career.
I love that these are like average and typical, because that means like you might not be average or typical. You might be an outlier there too. So these are like the averages, not necessarily where each office sits, right? So
yeah, that's an average Joe gut punch, not a Mike Tyson gut punch. Yeah, it gets worse. Yeah. This is brutal. So I mean, as you guys have probably put together, we're going to talk about write-offs and adjustments today. I think it's so important that everybody that's listening to this knows where they stand. They know the impact and what is happening in the industry right now, because things are getting wacky. It's getting a little crazy out there. I think that it's worth talking about a little bit why we're talking about this particular topic in January. So at Wood River Dental, we'd kind of had enough, right? So we'd been taking a beating on our adjustments and write-offs, primarily write-offs. And we got to a point where we analyzed the data and realized that we needed to get out from underneath the foothold of the insurance companies. And so we decided to go fee for service in January. And it's been a huge, I mean, that's not a small undertaking. And I don't say that like, oh yeah, we just jumped ship and it's been, all roses and easy. It's a huge process to do this, but we did it primarily, like I just said, because it was taking such a toll on the practice. And Jared, I mean, you've kind of been, talk about the difference of today versus where you were when you first purchased Wood River Dental. It's changed a lot, right? And also that makes it sound like you're old.
You're not wrong. I am old. As I'm approaching my 49th birthday this year, I'm thinking to myself, yikes, we've been in this for a long time. I think that maybe always kind of a fun story to share is the moment that I realized just how much our write-offs were killing us. Because as a young dentist and as a young business owner, after having bought my practice after 2 years out of school, I signed up for some dental insurances that I didn't understand what the consequence. I didn't understand all of the consequences of what that meant. Meaning, I knew that we would be busier, we'd have more patients, I'd be doing more dentistry, but I didn't understand the amount of write-offs and adjustments. Granted, this was back in 2008, 2009, and so the write-offs and adjustments, yes, we had some, but they weren't as significant as they are now. And I think we'll probably talk about that difference between 15 years ago as opposed to now. But I signed up for dental insurances, and true, I got busy, right? I mean, people started coming to my door. I started doing a lot of dentistry. Everybody was happy, right? The team was happy. We were busy. Patients were happy because they were getting their adjustment, but I didn't know how much we were adjusting because we decided on a whim to go ahead and just adjust our fees to whatever the reimbursement schedule rate was given to us by the dental insurance company. And so that way, and I remember having this conversation. It's like, well, we set it at that, so it looks like our write-offs are zero, so it doesn't look so bad. I thought, oh, that's not bad. That's a good idea. I don't know, and then after a while, after you got here and after Ryan got here, we said, let's actually take a look at these adjustments. Let's see what this means. So we readjusted our fee schedule to what our actual fees are, our UCRs, and then we actually got the first few EOBs back and started to review what we were actually writing off. And when I realized that I just fought with the patient regarding color and shape of a certain bridge and so forth, and in actuality, I wasn't even making any money on this. Like we were breaking even on this, almost probably maybe even losing money in this. I thought, this is ridiculous. Why are we doing this? Is not worth it. So I remember, I think it's one of the few times you see me actually get mad or angry, Dan. I was like so frustrated because like I've been doing this for 10 years. I didn't even look at my adjustments. I didn't know what it meant. And then as we work with other practices, we see the same things, like it's a total eye opener as far as this is actually what you're adjusting. Believe it or not, it's this much. And so this is a good conversation to have. Hopefully you have a few minutes to listen to this podcast, because this will help you hopefully make some decisions regarding your insurances, your reimbursements, and kind of the state of that area in the industry of dentistry right now.
I think that the personal path that we've trod there's a lot to be shared in that, and so we'll be sharing some of the tidbits, some more about like what Jared was just talking about, because I think it's meaningful of like how and why we exited, and we're happy to talk about that. By the way, if anyone ever wants to contact us and be like, "Hey, how'd you guys do this? Why'd you do it? What numbers were standing out?" We're going to hit some of those real quick, but I think before we do that, I think Ryan, would you mind just kind of going through and helping define the difference between what a write-off is versus an adjustment? Because I think in a lot of people's minds, they're the same thing.
So in a lot of a lot of practices, sometimes they get lumped together, but a typical contractual write-off is the difference between what you're billing your UCRs and what the insurance takes. So then at the practice level, there's usually a write-off amount that gets entered in, and off that procedure that then gets adjusted, or again is a write-off. And then there's typical adjustments at each practice that can be more in-house things, cash discount, those kind of things, in-house programs that they're running. Those are more of an adjustment, not necessarily a contract write-off. So just again, making sure when you're start to track these things, just having good, clean data as far as like what are we actually looking at, so that then you can get a clear look at like what's going on within the practice. Because even though you want to start tracking the, what am I really writing off, but now you want to get a little bit more granular in what you're looking at, like what are actual contractual write-offs with each individual insurance provider, and then what are different adjustments that you're making within the practice. Because then that gives you the ability to go in and look at it and then make some good decisions based on what data you're seeing within the practice. And you can again start to get like granular and like the write-offs from each individual insurance company. And then again, some of your in-house programs that you're running that you might think are great, or are awesome, and then you find out that they're also costing you a lot of money too, and not bringing in a lot of revenue. So again, just being, like you guys were talking about, just being aware of what's actually going on within the practice, and again, contractual write-offs, adjustments, and getting granular in all of those different things that affect your practice at every level. So yeah.
Yeah, and I want to say this up front too, really quick. If you're an associate or you are, you work for DSO or whatever, where you're not the practice owner and you think, oh, these don't affect me, you're dreaming. Like, these have a huge effect on your income, like, because you're probably paid on either net production or collections. And if you're writing off a bunch of the work you're doing, you're not getting paid as much as you would in an office that's tracking this stuff and is working to optimize this stuff. So I just want to go over some of these statistics that when I was reading it, I was telling Jared, I was like, holy crap. Like, I kind of freaked out a little bit. So you won't hear as much freak out of me right now, because I've already read them, but this is still pretty shocking. So, so in 2023, the ADA did a fee survey. And so PP write-offs average about 30 to 40% for participating providers, according to them. And again, that's self-reporting. That's a survey. Practice Booster found that some dentists write off up to 50%, depending on how many PPOs they accept. I trust this data probably the most. It's from Dental Intelligence. They have so many practices they can pull from. They get to see a broader range of actual data. And they're showing that an average PPO adjusts about 42 to 45%. So to the point we were talking about with Jared, so let's add some actual data to this, is the old norm was about 20 to 22%. And Jared, I remember you and I talking about that. And you're like, you were kind of disgusted. You were like, I can't believe. It's like, when I signed up for this stuff, I was only writing off like 20 to 25%. And now, so it used to be about 20 to 22%, but now the norm is about 42+%. And if you live in a competitive metropolitan market, you're probably closer to 50%. And Ryan, you've seen some pretty gnarly, what are some of the worst situations you've seen on the write-off end? So not adjustments, just write-offs.
Just write-offs. Go ahead, Jared.
So as you're thinking about that question, Ryan, let me just I want to add a little bit to what Dan is saying as far as the write-offs go. The reason why you've gone from 25 to 40 to 42% reimbursement or adjustment rate is because your fees continue to raise every year, as they should. Inflation goes up, lab charges us more, our hygiene costs, all of our costs go up. So we need to charge more just in order to keep up with the charge. The problem is the reimbursement rates coming in from the insurance company are not going up. Matter of fact, some of them may be even going down. So that's why this gap is growing and growing and growing, and makes it harder and harder to work with these insurance companies, because you're working more, producing more to take home the same or less than you were before. I mean, the average dentist is taking home less now than they were in 2013. It's absurd. I mean, inflation's gone up how much since then? The cost of housing alone, all these costs have gone up, but these insurance reimbursements, insurance companies are keeping our hands tied and making it very, very difficult to continue to partner with them, which is why we see this rise so much. So I just wanted to interject that a little bit, just so I know it just so makes sense as far as why this is going up so much. Go ahead.
I think
Ryan.
back in the day, it used to be a win-win-win situation where, it was good for the insurance company. They provided a good service for your patients. It was good for the patients and great for the dental office because they brought in new patients. But over time, it's just become kind of a win-lose-lose, still good for the insurance companies, but it's not great for the patients. They're not getting the care they need, and their benefits are not going up. I mean, that was one of the statistics that hit me, was like the amount of dental benefits has not raised since the 1970s. Like, you still get $2,000 worth of benefits, to spend in a year. And yet, here we are in 2026, it's not gone up at all. And again, the cost of what it costs a dental practice to have an insurance company come, like they're not like bringing you, like the advertising costs would be less than what you're getting from the insurance companies trying to partner with them, and it's just really become that kind of win-lose-lose situation, which is too bad. But you were asking, Dan, like some of the, like we had a pediatric office reach out this last week from California, and was just wanting to get a better grasp on how can I get my practice more profitable, and I'm struggling and not making ends meet, and so we were like, well, let's pop the hood and take a look at what's going on. And so we pulled the data and started looking at what the data was showing. It was kind of interesting because like the original numbers were coming back like this kid produces like almost $3 million a year. And I was like, that can't be right, because it's 900,000 that he's taken, like collections and stuff were like 900,000. And I kept thinking like, oh, we've got a data issue here. Like something's not calculating. So I went back through like every single month and pulled the data again. And like, it was all in write-offs. Like he was producing almost $3 million and taking home like 900,000, and just kind of unaware, so he's looking for opportunities. Like, how do I produce more? How do I work, more? And he's working 5 days a week, works one every day, every 2 weeks at a different office to, bring some revenue home. And you're just like, this poor kid is just like killing himself. And there's just no upside there. Like, you can't outwork this problem. Like, and he's writing off 60%. Like just year to date numbers had done like 1.2 million this year, halfway through the year, 1.2 million, 1.3 million almost, and is taking home like his net is like 480 on that. Like it's insane. And so, and again, just, trying to work with insurance companies to bring in new patients to grow his practice. And then he's at this position where he's like working his guts out and like not taking enough home to then, pay your employees, because he's still doing $3 million worth of dentistry, right? So he's got the staff, he's got the supplies, the equipment, like to do that much dentistry, but yet he his portion of the pie is just so small. And and this isn't like a one-off situation. Like this is a pretty bad one, right? Like when you're looking at those, but like this is stuff we see constantly. And then some docs are like Jared said, they're looking at their net and can't figure out what's going on, because they're not even looking at what did I really produce and what did I write off. They're just like, things just don't add up. Like, I don't know what's going on. So so that was an eye opener for him, I think. And again, just an issue within the practices that if you got a blind eye to it, you're not seeing it. So, but
if you're writing off over 60%, Ryan, can you register as a nonprofit at that point in time? Because you're not really making any profit.
You're definitely a nonprofit. I don't know that you can register, that the IRS will let you get away with that.
That'll make a bunch of money as a nonprofit. I don't know how that works, but
yeah, you're definitely running a nonprofit at that point. And you feel for the guy, because like he's trying to find ways to outwork that, and you're just like, you can't outwork that. You can't.
Yeah, I mean, and 3 million by I mean, I get it. Pedodontists are a different breed. They can produce at an incredible level, but still 3 million, that's a freaking baller. You know what I mean? That's no joke for one guy to be producing 3 million. That's amazing. But then to get absolutely have the rug pulled out from under you on a consistent basis it's so wrong, right? It just talking about it, you feel dirty, you're like, ugh, this is wrong. I mean, and then there's the other, I just thought of too, Ryan, is that we have, we worked with an EA client in California who, during this, one of the issues that's happening in California is that depending on where you live, especially, the hygiene, and a lot of you are going to relate to this. The hygiene issue is so big, and he's like, I have to pay my hygienist so much money. And when we ran the numbers, we're like, you know that you're like you're going to lose, like, because of your contractual write-offs, you're going to lose money on every single encounter with your hygienist, like everything. You're going to lose money on it. You're going to be in the negative. And he's like, yeah, but I can't not, have my hygiene team there. And so you're getting hit on two sides in the current market in a lot of places, where you're taking a bath on the write-off side, on the insurance side, and then you're getting beat up on the overhead side. So to Jared's point earlier, there's insurances aren't even coming remotely close to keeping up with inflation. Never mind the actual like market pull and strain that due to the weird situations post COVID. So there's all these like weird scenarios that are playing out that we're really seeing it a lot. And if anyone's reading their economic reports in the dental space, especially if you have an ear to the ground, we had a great meeting with up in Montana with some of our members up in Montana, one of which works with a DSO, and he was talking about how they're even in the DSO space, things are getting beat up and things are having to change. And so nobody's immune to this, and we're all kind of taking a bit of it on the chin. I think that it's worth talking about. We're talking about these high numbers, and so I think it's important that we say, well, what should we be doing, right? Like, where is a healthy write-off, and how do you know if it's your problem? So a healthy write-off, if it's a high frequency code, right, you should be aiming for 20% or under. And if you're 30%, if your write-offs are 30% on your bread and butter codes, that's a red flag. You should be looking at that going, this isn't good. So an overall practice write-off percentage approaching 30% is the moment you need to raise that, pull the emergency alarm and say, okay, we need to go and start looking at this and find out what's happening. So, and to go with that, and Ryan, you can speak to this better than I can, but there's a companion metric with this data set, and it's your collection percentage on adjusted production. So we see that being an issue with some offices as well. So it should be 98% plus. So your collection percentage on your adjusted production should be 98%. And if you're producing well, but your net collections are less than 98%, then you either have the problem in your contracts or your front desk isn't doing their job like they should. They could have a problem or a leak or maybe something deeper, like someone's stealing money from you. So these are red flags, right?
Right. Yeah, and red flags, and again, just the cost of, like, the business side of things, like again, like the write-offs, but then like Dan's saying, now you have like the collection gap, right? So making sure you're doing a good job on collections as well, and dealing with the insurance companies. Some insurance companies are very hard to deal with. We've had, multiple practices that we've talked to have, they've had to write off like several $100,000 in just uncollectible insurance claims that they just, people up front aren't doing a good job of collecting. The insurance companies are digging in their heels on reimbursements and what they approve, what they don't approve. And so you end up with now these, collection gaps as well as insurance write-offs on top of that, which just compound the problem. And so, you just really got to, look at the data and find good partners to work with. Some insurance companies in some places, it's a good deal. It's a win-win in some of these small towns where we have, great dentists, and they're serving their school districts and communities, and they're under insurance companies, and they're kind of the only game in town. Like, and some of these insurance companies and some of these places are okay to work with, right? And the doc's making good money if he's watching his stuff. But again, looking at that 20 to 30%, write-offs on from the insurance company, and if that's doable for the practice and still healthy, then it works. And then But again, like making sure you're looking at the data. What is my total production? What am I adjusting? What are my insurance contract write-offs? What is my collection rate on all of that? Like they're all important metrics, because then, like you guys were talking, now we get to this point. Now we got to start taking out overhead cost, payroll, and supplies, and then what are you left with at the end, right? As the owner, as the doc, and what are you working for day by day? And so it's great to track those, and track. Dan was talking about high frequency procedures. Now we're with the data, you can go in and look at like how much am I writing off by each procedure, which was also interesting. That same office we did, like there was procedures he was writing off 105% of stuff, which is like, you lost money on every time you do that procedure, you're losing money. Like, and so it just, if you don't know, you don't know, but you got to have the data to take a look at and then make good decisions on. Yeah.
Yeah, and part of the reason why that is important is because the overhead that you pay is based on how much money you collect. Not based upon how much you produce. You can't. And what I'm trying to say is your production number is vanity, essentially, especially if your collection percentage is, or if your adjustment percentage is high, or your collection percentage is a little lower. The production number is just a number. I mean, yeah, like you said, like with this example that we use of this practice producing $3 million, it sounds amazing. And when you tell your dental school friends, I own a practice that produces $3 million, that sounds fantastic. But when it comes down to it, you're paying all these people based upon the 900,000 that you've collected. And if your overhead is 60, 70, 80% of that, yeah, you're not taking home a lot of money, especially if you're living in California, where the cost of living is way higher than everybody else. So this is why it's important to take a look at all of those numbers, like Grant is saying. Yes, know what your overall production is. Yes, know what your write-off percentage is. And yes, know what your collections percentage. Those are all three incredibly important parts of the equation of having a profitable practice.
And I think just real quick to add to that, another data point that I think is worth sharing, and I'm not saying this is ideal, but the average overhead for a general practice office is in that 60 to 65% of collections. So to Jared's point, it's of collections, not of production. So your overhead is based on, don't ever base your overhead off production. Doesn't make sense. So it's 60 to 65% of collections is the average. And that takes into account, a lot of the smaller markets. It takes into account corporate. It's all this stuff. So just kind of know that, like, some markets, I get it, you're going to be higher than that. So I know that some markets it's lower, but that should be, again, where that's a whole different podcast to talk about overhead, but it's important that you guys know where, like, how to calculate your overhead and what the averages are, at least what a healthy average should be. Let's talk a little bit about what you should and shouldn't be writing off. This is one of my, like, I don't know. I don't want to say pet peeve. Maybe it's a pet peeve. I'm not sure. And one of the things that I see that happens a lot, and this drives me crazy, and I've talked about it over and over again because it drives me so nuts, is that I jokingly call it one of the two great commandments. And it's don't adjust your fees down to UCNRs. We're going to get into that a little bit more in a minute. That can actually be illegal, just so you know, depending on your contract. But don't do that. Don't adjust your fees down to not to UCNRs, to reimbursements. Don't adjust your UCNR to whatever the insurance is reimbursing. And I'm bringing this up right now before we get into the talking about what we should and shouldn't be writing off. Because if you do that, you have no ability to track your data. You've just cleaned out any ability that you have. You do that, you're highly susceptible to be embezzled from. It is so easy for someone to embezzle from you if you don't have the ability to see where your money is going and your write-offs are. So make sure your fees are keeping up with the fees in your area. Make sure they're keeping up with inflation. Even if you're just like, yeah, but I'm writing off, 80% of this. it doesn't matter. You still need to be tracking this, because if you don't have the ability to see the gap between what you should be getting paid and what you actually are getting paid, you have no clue of where you sit in the landscape, and your financials are going to be all jacked up. You're not going to know what's happening. So I just want to get that up front before we get into this, because I just feel like it's just so important, and we see this mistake being made over and over again. So don't let whoever it is, your financial manager or office manager or whoever, talk you into doing that. Big no. So let's talk a little bit about like contractual versus avoidable write-offs. I think we've kind of beat the whole idea of a contractual write-off. We've beat that dead horse a little bit. And the only way to really address those that I know of, guys, and let's think if you can think of anything else, is by you can either renegotiate your fees, your reimbursement fees, or just drop the plan altogether, right?
Yeah. That's why they call it contractual, right? You're obligated, right? Yeah.
So let's talk a little bit about the avoidable write-offs. And this is money in the couch cushions right here. And this is something that, Ryan, I think you've seen this happen a time or two, and I'm going to speak to it a little bit as well, because I'm going to tell you guys a quick story before we get into this. When I was in my early 20s, I went to work for a dental insurance company. I know. Don't shoot me. I was young and foolish. I didn't know what I was doing. And I thought it would be like a good insight into like understanding the business workings of the dental world, because I was planning on going to dental school at that point. And I was sitting across, we had these cubicles, and I was sitting across from the claims managers. There was that they just would process claims all day. And I remember hearing them pretty frequently, like saying, "Oh, yes, sorry about that. We'll get that adjusted and sent back out." They would say it like enough that I paid it like caught my attention. It's funny. One day I went over and I was like, "What is happening? Why do you keep having to have that conversation after she had just gotten off the phone with somebody?" And she's like, "Oh, well, our system randomly denies claims." She's like, "So if they don't catch it, then we don't have to pay on it. But if they catch it, we're just told to just fix it on the spot and then just process the claim." I was like, that is the dirtiest, like most messed up thing that they actually built into the system, that just randomly denies claims because people don't question it. So the patients are just like, eh. So that kind of thing is happening. But also on our end, that lets us know, like, we have to be sharp on our end to make sure that we're submitting the right stuff, right? So, Jared, why don't you tell the story of the wrong code that we discovered? That was a fun day.
Yeah, you and you just get used to using codes, or you don't check all your codes after a while, and the ADA will go through and they'll change some codes, or the insurance company will change what codes they'll reimburse for, but they're not going to tell you that. And so, or they may send out a blast letter that you never read, or anybody ever reads it, right? And so here you are 3, 4, 5, 6 years later using a code that you're just not getting reimbursed for. And if you don't have somebody sharp or somebody at the checking your reimbursement rates or your contractual write-offs, then they'll just assume that it's just something that we automatically contractually write off. So, yeah, it was, I don't know, Dan, I don't remember how long it was. We figured out we were using the wrong codes. I think it was for x-rays, right?
Yeah, it was an x-ray code.
It's an x-ray code. We're using the wrong code. And it was years later. And I don't even think we took the time to sit down and calculate how much money we probably lost because we didn't submit the correct code. But I remember we did lose our lid for a hot minute there, as far as, can't believe that these simple, dumb mistakes can cost us hundreds of thousands of dollars, maybe over the course of 5, 6, 7 years. These are the checking your codes and making sure that your codes are being submitted correctly. That's one of the easiest denials for an insurance company to make. Hey, it's wrong code, denied. Not they're not going to tell you should have used this code instead, or this is our new updated code. They're just going to say, no, it's an old code. Don't use it. Denied. They may not even tell you it's an old code. They say, oh, this code is not reimbursed under their plan. Is probably what they'll say. And so it's up to us to figure out what code is reimbursed properly. It was frustrating.
Yeah. So there's coding errors, there's denied claims, like just randomly denied claims. Make sure that those are getting appealed. Late claim submissions, that's an issue. I mean, Ryan, we've been working with an office. I don't even want to say where it is because it's such a frustrating thing that how they had an AR. Was it Medicaid or Medicare? I can't remember. Medicaid, right? That it was like in the hundreds of close to $100,000 or something like that, right? That when he had got the practice, it just sat in there and they couldn't collect on it.
Oh yeah, it's several $100,000. And then sometimes we see this, I'll see this commonly on some of the practices you work with. You get into the AR and you've got this huge lump out there of like several $100,000 that's just slowly moving, into this 90-day bucket. 90-day plus is where you usually find these. Is like you'll look at the AR and it's these again, like all these things that the guys just talked about, not being addressed. You've got these issues within the practice that aren't being discussed or fixed, or you've got the wrong person in the wrong seat up front that just doesn't know how to deal with the insurance properly. We're not making decisions. And then over time, these things just start to pile up into that 90-day plus claims, and you'll get into a practice and see this big graph of like, boop. It's just like this fund of like lost money that's just sitting there. And then, you get a year out on these and you might as well write them off because you're not going to collect on any of that stuff that's gone that long. And so, to your point is like, I think just making sure you've got the right person in the right seat, looking at that stuff up front, and then you're managing these things. And as we find these issues, we've been billing the wrong code. Well, now we can go back and fix that, get that cleaned up, and move forward. But it's taking time to identify issues. Again, having the right people work those things, and making sure your financial manager, whoever's dealing with your claims, is competent and working on that. And don't turn it's that blind eye again. It's that same thing we were talking about with the write-offs that you're not looking at. You're also like got this accumulating bucket of uncollected insurance fees that, claims that is just building and building and building. And so over time, there's, a couple $100,000 sitting there in overdue claims that you're going to just eat at some point. So.
It's this whole thing is so aggravating and frustrating on so many levels of where we can end up getting taken advantage of or lose money or, it's just it's a eye-opening discussion anytime we have this, with another office. And it happens so much that I think that anyone listening right now is going to be able to relate to at least some areas that we're talking about. But I think there are some landmines that we need to be aware of. We've hit on a few of these and we've talked about like, where not to adjust or don't make the mistake of having to adjust or write off because, you haven't closed the gaps in your practice. But there's some stuff that like I referred to earlier that I want to come back and revisit because you can actually get in trouble over this idea of waiving your copay or adjusting your ledger after billing. So just be really, really careful. And I want to be clear on that. So if you adjust a submitted fee down to match what the insurance pays so that the patient owes nothing, so they don't have to pay anything. If you're under contract and you do that after you bill, so you submit the claim with your usual and customary, and then you adjust that down their fee. So you basically have two fee schedules. You have the patient facing fee schedule, and then you have the insurance facing fee schedule. The insurance facing fee schedule being what your UCNR would be, and then your patient-facing fee schedule being the one that just matches the reimbursement, that's actually illegal. You can't do that. Like, and you need to be careful, like, and check with your front desk and say, we don't have 2 fee schedules, do we? Or 3 fee schedules or 4 fee schedules. Because that's a big issue. And so not only does it mess your numbers up and you can get embezzled, but also you have to watch out because you contractually you can't do that. So and I know, like, I don't know about you guys, but when we were in network, I don't remember ever sitting down and like going through our contract with a fine tooth comb, like going, and there's stuff in there that they can hold us liable for that we may not be aware of. So just watch out on like that one. That one's a huge one. And then don't routinely waive the copay. Just don't just waive it. That's part of your contracted fee. You need to be careful. You can be giving away a lot of money.
When talking about like coding and talking about billing and talking about coding errors, wrong tooth, wrong number, as well, about the submissions, resubmitting claims and so forth, that falls on your team members. Following up on patient balance. These are things that I occasionally have to remind our team that this is a fee for service business. This is not a free for service business. So we pay you guys based upon the money that we collect, and as generous as we are, and we're generous, and I think every dentist out there is generous and has a generous heart. I think it's part of the characteristic of every dentist. We want to help everybody out. There's a time and place to write off and adjust purposefully those things. But if you're writing off and adjusting without purpose, you are potentially getting yourself into trouble, making it difficult to make payroll, or just setting expectations for the office that aren't realistic for future growth. So it's just one thing we've had to remind our team on occasion, like, we run a charity. This isn't the charity that we do. We this is a fee for service, but we do, if you have a case that you want it to be, you think it's a valid charitable case and valid write-off, or an adjustment, or an adjustment that we want to make as a team, let us know. Bring it to us. We'd be happy to review all those cases and do that. But we don't make these blanket, always adjust this or always adjust that, because then the team makes, they take that and they think, oh, they're okay with us adjusting this. We'll just adjust this as well. We just, it doesn't create this sense of, hey, this is a fee for service. They need to collect money in order to continue on with this business.
It would be nice if there was a software that tracked all this stuff and that our front office could use. Ryan, that would be amazing, wouldn't it?
It would be awesome. Should have that in every practice.
To talk a little bit about the EAOS, I think it's important that people know we're trying to get the word out that this is available. And it's like, it is an unbelievable game changer. It's a freaking game changer. So Ryan, just talk a little bit about like we've got client reports, we've got P&L reports on this. We've got the ability to get very granular with write-offs and see. There's a reason that when Ryan was talking earlier about like on specific codes, we can see what offices are writing off specific to every code, or not every code. Well, yeah, every code actually. We talk a little bit about this is a brainchild of Ryan, and it's one of his. I guess he's kind of one of your babies, right, Ryan?
Yeah. Well, I think one of our babies, like, again, this has been a big issue for us over the past, since I got here the past 6 years of just dealing with the write-offs has been huge. And so this comes from a lot of, time in the trenches, as far as like, what would be really great if we had something like this. And so, with the being able to do some of the coding and be able to build some of our own custom reporting, now we can take the data that we're getting out of like Dental Intel or practice management softwares, and now we've been able to like next level that and get much more granular on write-offs and insurance things, and be able to take like your data from your practice and be able to tell you, what reimbursement rates are for each of the insurance companies you work with, which are your best reimbursing payers, which codes are your best codes for you as an office, how much of each code are you writing off, those kind of things you can look at and get much more granular. So we've created, one of the tools we use is called the Climb Report. It's based just on this insurance problem, and again provides you all the data with like, what are you producing, what are you writing off, what are you adjusting, what are all those categories, and again, what does that mean for each payer, for each provider, how much is each provider producing, how much is each provider adjusting, and you can get super granular on this. And then again, the idea behind here is like, once you have the data, now you can start looking at like making good decisions. Like, if you know that certain insurance companies are terrible at reimbursement and you've only got a few patients that you're dealing with, like, that's probably a good place to start making some changes and some adjustments. You're spending a lot of time and effort and losing money with this portion of patients. And again, who are our ideal patients, or who is our best insurance company that we're working with? Who is an okay partner to work with? So having that data, and again, on a granular level to where you can look at it and be like, you can't just see, the overall thing, but you can see all of the details. That gives you clarity. And then with that clarity, you can make decisions on moving forward. And again, that's the other thing is like noticing, who are your best reimbursing patients, or what's a cash patient compared to a insurance patient. Well, now you can start to then change the structure of your practice so that those write-off percentages over time continue to reduce, right? Because you're bringing in now the right patients into your practice. You're spending time with the right patients. That was that was one of the big things when we looked at like the amount of time you guys were working on, Delta patients or Blue Cross patients. And it's like, gosh, we're writing off like 30 to 40% on some of this stuff. It's like you could see a cash paying patient or a patient benefit patient. You could see a third of those and collect as much. So it's just making good use of your time, making good use of the data. And so having the Climb Report is fantastic, and allowing us to look at each month. We upload the data. We can see, exactly where we are year to date. We can see for the month. And again, how well we're doing compared to previous year. And if we're moving in the right direction on the decisions that we're making. So, again, we love solving problems. And I think that makes us, the other thing that I think makes us unique in the coaching aspect is that we, you two are working dentists. We do this every day. You're downstairs working on patients every day. We have two practices that we're working out of, and we have teams and employees, and we deal with insurance claims, and we know all of this stuff because we're in the trenches every day. And so we're constantly looking at how do we solve this problem. And if it works for us, it tends to work for a lot of other dental practices too. So,
I want to give a real world example of how we applied this data from the software. So one of the things that we looked at when we went out of network, we said, okay, now that we're out of network, we had our insurance coordinator send out early on in January, we had her send out basically as quickly as we could, got some claims out so we could see what we were getting reimbursed. Because out of network reimbursements are different than in network reimbursements. And some insurances actually pay really well out of network. And so one of the big employers in our valley, it came back that they were basically covering everything, all the preventative care at 100%. And so we were like, dang, this is awesome. So we developed a marketing campaign for that particular, because there's quite a few employees out of that that particular business. And so we targeted them specifically and built a campaign addressing the fact that they are still covered at 100% if they come to Wood River Dental. So that was something that was important to us, and we were able to retain a lot of those patients that were employees there because of that, because they were really worried about, oh, we're going to lose our benefits there because you guys are out of network, all this other stuff. And that's the other thing that's wild, is that even within a specific insurance contract, you can have different levels of reimbursements. Delta's notorious for this, so it depends if it's Delta of California, Delta of Idaho, Delta, all these different divisions of Delta, they can reimburse. And then based on the plan that they're on, they can reimburse differently. So having a software to go through and be able to look at this and find out, like, hey, who is reimbursing at what, who's our good payers, like Ryan was saying, who's our bad ones, that is the application of that is now you can build a campaign or whatever and try to go and put the right lure in the right pond to get the patients that you want in your practice. So that worked really well for us. And I think that had we not had that data, if we didn't have the software to go and pull that stuff, we couldn't do that. We couldn't be as targeted as we were. So yeah, this is massively important. I hope you guys, please let us know if you want a demo on this software, because it is, I'm telling you guys, it's a game changer. It's freaking awesome. Really quickly, there's probably some of you are having a question of how to negotiate higher reimbursements. That is not in our wheelhouse, but we do want to let you know a couple of small things that we do know about it. The recommendation on it is to renegotiate every 24 months. But you need to know that it can take a while. We do work with Best for Dentistry. They have a contract with some folks that do negotiate and renegotiations. If you'd like to learn more about them, go to Best for Dentistry, or you can contact us with that as well. But the bottom line is that if you feel like you're stuck in the insurance trap and you're like, I can't see my way out of this for a while, then at a minimum, you should be looking at renegotiating your reimbursement. So negotiate to a higher reimbursement for sure. Do you guys have anything you want to add to that? I mean, for me, it's kind of like, that's a dark space that I don't really understand.
I would just say the reason why we didn't do it, and we don't know much about it, is because we were down to Delta. We had Blue Cross and Delta. We dropped Blue Cross, and then Delta, at least in the state of Idaho, is a non-negotiable entity. So they basically said, we're not going to negotiate our fees with you guys. So it didn't be, and we talked to a couple of these companies, because there are companies out there. There's the WHO, right? The companies out there that exist just for this purpose, to work with your practice and negotiate these fees. And when we talked to them, they said, it's not even worth it. Don't even pay us money because Delta's not going to negotiate. So depending on where you're at, where you're listening from, it'd probably be good to look into if you want to try to go through the renegotiation process. It's worth looking into it. It's just that if you're in Idaho, I don't know that it's worth it, or Utah, I think it's very difficult as well. But yeah, wherever you're listening, it may be worth looking into.
Just one other thing, on just a quick note on that, was I did meet with an office 2 weeks ago that have a WHO. They're in Utah, and they have a company who is working to renegotiate rates, but providing them the client report, the insurance data that we pulled, and then we gave them access to have this to then have a better negotiating foothold, right? Like, here's the data. you can give this to your guy to go take and try to renegotiate. If any of this information is helpful for him to get you a better deal on your reimbursements, happy to provide that to you and to him. So, and so hopefully that goes well for them. And again, they were like, well, this is better data than what we gave him to work with. So, which was good.
Well, I mean, and to that point, like the ADA Health Policy Institute, the fourth quarter, 2025 fourth quarter, state of the U.S. dental economy, their statement, and I thought this was interesting that there's a lot going on with that whole situation, but it was interesting because they actually stated outright that reimbursement rates are not keeping pace with inflation, like you were talking about earlier, Ryan. I mean, or rising practice expenses. And that's the other thing is like there's inflation, and then there's like we were talking about earlier about the hygiene issue and some of the other overhead problems is that there's a huge spike in dental practice expenses. So the long-term trend, like some of the insurance and companies like did a little tick up so that they could say, no, we're increased our fees. You probably got a letter from some of the insurance companies that said that, like, we increased our reimbursement rates. The reality is it's a drop in the bucket, right? So the rates ticked up slightly in early 2026, but the long-term trend is way behind. And then the other interesting thing is that the fee for service migration is impressive. So what we've seen is that the fee for service offices went from about 6% up to 16% as people are exiting and going fee for service. They're getting out of insurance because it's just, you can't stay in it. It's the economy won't, in some markets, it's just not permitting it. So kudos to that 10% that got out. Watch out too, just really quickly, I want to hit these. Watch out for down coding. So that's a trend right now that we're seeing with the AI coming into the dental insurance world. We're seeing some not awesome things happening. Down coding is one of them. So paying for the cheaper procedure, like an amalgam versus a composite, they'll actually say, no, we won't cover that. They'll want a large filling over a crown and buildup, for example. We've seen that firsthand where they've denied claims for a crown because they want us to do a 8 surface filling, on a tooth. The other thing is watch out for bundling. We're seeing that as well, where they're denying, say, for example, in your contract, it could say that when you file a 2740, which is a crown, that the buildup is included in that fee. Which, I mean, wrap your head around that for a second. What the heck is the point of the other code and fee? But they're bundling those, and they're saying, no, you have to write off the buildup. Or if you do a gingivectomy, you have to write that off. That's they're called a global fee. So those bundled fees are called a global fee. And so look at that in your contract. That could be happening. Trying to think of what else, what we've seen. We talked about denials. And then you're going to see a push for virtual credit card payments because they a lot of times will get a fee from those. And you don't get that money. They actually take it out of your reimbursement. So there's just a lot of like skimming and like slick ways that they are finding to increase their revenue while lowering ours. So yeah, lots of crappy things. Now, I do want to talk a little bit about the reform that's happening right now. There is some pushback that this is encouraging. There were 37 in 2025. There were 37 dental insurance reform laws passed across 18 states. This was targeting down coding, bundling, virtual credit card opt-in. And this, there's a lot of talk about this. I don't want to get political, but there's been a lot of discussion. I read it. I've been in it on the boards online. But a lot of this has been driven by ADA advocacy. So, that is happening. This is cool and kind of fascinating. Delta Dental faced a class action lawsuit in 4 states alleging suppressed provider reimbursement. So there's that. And then we're seeing like some the Centers for Medicare and Medicaid Services, they're proposed extending electronic prior authorization standards to dental. So I don't know, that's not going to really help your bottom line a ton. That's more of a admin burden reducer, I guess. And then just a big heads up for everybody to know that Delta Dental is eliminating check payments by the end of 2026. So that's going away. So you need to get your electronic payments and reconciliation workflow going. So yeah, a lot of changes right now. I just want to kind of share what the landscape's looking like, so everybody knows what's going on. There's, to me, the bottom line is that we need to get our freaking data ducks in a row. We say that all the time. So, and then B, you need to know what's happening in the landscape and the impact it's having on, once you have your data cleaned up and ready to go, you need to look at the impact. I mean, Ryan, I mean, that's kind of like, you know, that's been such a huge part of the eye-opening process when we share even a growth report with offices, right? Like that's something that we see immediately that can uncover some trouble points, some red flags. What are you seeing happening the most on that front?
Yeah, as far as like new growth reports too, one of the things we've added on the new growth reports is this write-off component because in the past that wasn't necessarily an area that was targeted as a spot to get increased revenue from. So, which is interesting. And so, from a growth report standpoint, we've now added that as well. So, like, again, if any of you are interested in, again, us popping the hood and taking a look under at kind of giving you some good data on where you're at with your practices, a growth report is a fantastic way to do that. If you have dental intel, we can do it very quickly. Even if you don't have dental intel, you're using some kind of other software, we're able to pull a growth report and get that put together for you. So again, just having the data, being aware of what's going on, and then just to add to your talking points that you just did, Dan, about practices going fee for service and kind of a trend there too. One of the things that was kind of eye opening for us here, and when we exited here in the valley, the two other large offices in our valley exited Delta at the exact same time we did, which was just, again, kind of a reassurance to our patients that, you know, of kind of the situation with the insurance companies, that it's not like an isolated event or we're trying to just get more money back for our practice, but that they just, aren't good partners to work with and or hard to deal with, so that was just kind of an interesting side fact that I thought was great, was that it wasn't just our practice that was like struggling and trying to find ways of like, improving things, but uh, the other two large practices here in the valley were dealing with the exact same problem. So.
Yeah, Jared, I think if you had some advice, based on our experience with our own offices and with other offices I mean, it's a whole podcast in and of itself of how to exit or, kind of address all this stuff. What would you say is like a good starting point?
Probably a good starting point is define your philosophy as far as what you're trying to accomplish and how you want to do it. So for us, our philosophy, we really wanted to treat our community. We have a small town practice, but we do this world class dentistry. That's what we wanted to do, but we couldn't do that by running the schedule that Delta and other insurance companies wanted us to run. With the lower reimbursement rates, having to see more people, rushing through exams, rushing through procedures, and so forth. So we had to make the decision of, look, we still want to treat everybody in our community. But for us, it was the 30 to 40 to 50% reimbursement cut adjustment it was too much for us. And so we were okay. We decided, hey, we're okay with a 20% adjustment. And so we're going to go ahead and just create our own plan. And we're not the first one. We didn't invent this. This is, I'm talking about our patient benefit plan. There's a lot of data and information on this, but we said, look, we want to offer this to the community. This is a win-win. This is where you guys can still come. You can still get the correct amount of discount. But we can still take the time now that we need to work with everybody, use the right materials, and to do the world-class dentistry that we want to do. And we think that you guys all deserve that. We can do that now with this plan. And so that was our philosophy, is like, look, we tried. We worked with the dental insurance company, for 20 years, and it just they made it so that we can't provide the dentistry we want to based upon our philosophy. So we made the proper adjustments, and like Dan, you said earlier, it's difficult. It's a hard process, but here we are 6 months into this thing, and it's going well. It's proving to be what we thought it would be. We're seeing the right patients, the patients who appreciate the value for all of these things, and we're able to provide the care that we need to. And we feel like we're doing a really good job. So that's what I would say. One of the first things is define the philosophy of what you're willing and want to. If you want to be the office that has a super high production number, regardless of your collections or adjustment percentage, then, or if you like the sensation of being just busy, right? We've dealt with this before. Other dentists who are like, I'm just not busy. Okay, if you want to be busy, then sign up with a dental insurance company. They will make your office busy. That's it. Not productive. You're not, and maybe productive, but not efficient. You're not going to be collecting a lot of money. But if that's what you want to do, then then pursue that route. If you have a different philosophy, then make sure you define that, because those decisions, make sure you have the data to back up those decisions. And if that's where Elevation Association comes in big time. It's like Ryan said several times on this podcast, let's pop the hood. We'll look under, we will give you the data, and we will tell you, if you want to follow this path, this is where the data is saying you're going to end up. If you want to do it that way, great. By all means, we'll support you in however way we can. But as long as you make this informed decision, don't go into this blindly based off an emotion.
That's wait, don't make emotional business decisions. What are you talking about? That's my philosophy. Speaking of philosophy, that's my philosophy. Just run off pure emotion. What could go wrong?
What could go wrong?
So, to back to that, and Ryan, just if I want to kind of talk about this software one last time. And just to be clear, if you want to see how this stuff can affect your office, let's set up a demo. Let's get you on a Zoom call and show you what these write-off reports by payer looks like. Let's show you what the write-off reports by code look like. Your collections percentage on adjusted production. Let's see if you're hitting the marks. The growth report is one way. That's a really slick way. By the way, we don't charge for the demo. We don't charge for a growth report. This is just stuff. We're trying to help as many dentists as we can. We're really trying to help the offices stay viable, stay profitable. We can, one of the cool things is we can look at those top 20, 30 codes, flag anything that's, that's higher than 20% write-off on them. We can help you to audit your avoidable write-offs, like we're talking about when grandma and grandpa come and get work done, or employee work, or the senior discount, whatever the heck you've got. We can look at that and make sure that that those are good, but then the avoidable ones, like bad codes, bad submissions, that kind of stuff can be found. There's a lot of things in the just by meeting with us that we can give you and show you right away that you can implement. So, please, we develop this stuff to help other practices. Obviously, we've developed it to help our practice as well, so we know it works. And so it's tested in-house. We make sure everything is functional. So this is really something that we feel is so impactful. And we really believe that once you see it, you're going to be like, how did I live without this thing? It is that impressive, and it's that important. So yeah, I think, Ryan, if there's any advice for a starting point for you, same question to Jared, where would you like to see, so they have their philosophy to define what's the next step after that in your mind?
Yeah, I think getting the data, like getting a good plan in place, right? Like, and I think just goes back to what Dan said. Let's get a growth report put together. Let's get a climb report and insurance adjustment report put together for you. And again, just let you see where you can start to tweak and make some adjustments to, again, start moving your practice in the right direction. So it's getting that. So, and like Dan said, it's free, doesn't cost anything. We'd love to do that. The value you'll find from that report could save you, thousands to hundred thousands to millions in a year. Just depends on your practice. So, but would eager to do that for you, everybody, and help you out. So, yeah.
Cool. Okay. You can reach us. We're on social media, elevationassociation.com. You can, we love talking with offices. So don't feel we're not going to hold you to any obligations. If you have some curiosity questions or want some direction or maybe some referrals to something else that we can help out with it, let's network, man. Let's put it together. So reach out to us and contact us. Any other thoughts before we sign off, gentlemen?
Awesome. Thanks. Great podcast.
All right. Cheers. We'll see you guys next time.
All right.